So site of care is really interesting. A Health Affairs article just came out last week, the April 17th issue of Health Affairs, that looked at what's happened as a result of 340B and the movement of site of care. And literally over the last 5 years, there's been a doubling of hospital-owned sites of care. And that could be as much as 50 to 60% of all care is now provided in a setting where the ownership of that setting is an IDN, an integrated delivery network. And we have to think about what's the impact societally? And one thing we do know is that hospital-owned sites of care are more costly. Data that was actually developed by COA and been published shows that could be 38-40% higher. We don't really talk about access differences and does that site of care impact on patient access. We don't really look at patient quality of life, time lost at work. There's lots of other aspects that we don't really have well studied to know what that site of care story is. We need to understand that, and we need to understand the implications of that more so than just from cost. And I think that's going to be very important as we continue to look at the sites of care shift that have been happening as there's been this consolidation in healthcare.